Good morning, everyone. First of all, I want to say thank you so much for attending the conference today, our final meeting for 2020, which has been a really interesting year. But guess what? We're here and we've made it. Please understand that we have muted everyone, and don't unmute yourself unless Donna asks you to. If you have a question, could you please type it in? Or I think there's a place where you can raise your hand. Or you can also email me the question. But again, Donna's the host and she's in control of everything for today. So again, we want to say welcome on behalf of the board of directors, and I know they all are on here. We want to let you know. So, okay, let's go over the housekeeping rules. Our participants will be muted throughout the presentation. You may request to be unmuted to speak in the chat. Drawing winners have 10 seconds to respond. So Donna's gonna pick a name or a number, and you got 10 seconds to respond. We want you to show your faces so we can see you. And the number's on here if you have any technical issues. And I'll also put my name in the chat. So we're gonna start with our first speaker, Dr. Jane Kelly. She has a long background in clinical medicine and public health with 13 years providing direct patient care in the Indian Health Service. I'm not gonna read her entire bio, but it's there. I wanna say thank you, Dr. Kelly, for joining us today. We look forward to all of the information that you have. And again, if we have any questions afterwards, please put them in the chat. We're ready for Dr. Kelly.
Great, thank you, and good morning, everyone. I have some slides, so hang on a minute while I see if I can share my screen. Oh, just wait, I'm getting the host disabled participant. Oh, okay, you did. Thank you. Sorry for the delay. Can you see my screen now?
Yes.
Okay, great. Excuse the fact that I didn't change the date on this, but I hopefully we will not get interrupted as we were last week. What I'd like to do for the most efficient timing is that we had a talk. I gave a talk to a smaller group of people last week, and I believe that talk was recorded and those slides are available, where we talked about how were these new vaccines created so quickly, how can a vaccine trial demonstrate safety in such a short period of time, how do they work, what side effects to expect. And I think for the sake of time, I would encourage people to look at that, either listen to that recording or at least click through those slides, because I'm not going to repeat most of that information today. What I want to do is focus more on how was the vaccine tested and what do we know about safety. But even before we do that, I want to make a couple of comments about influenza. We are still in flu season, and a combination of COVID-19 and influenza, a co-infection with those two diseases, would be bad news. We are seeing some cases in this country of COVID-19 and influenza co-infection. We don't want that to happen here. Fortunately, at least thus far, it's like so far so good. This is a slide that shows our state statistics on influenza-like illness. And that top bar where it's all the green bars is this flu season so far this year, 2021. And we are seeing minimal levels of influenza. If you look back this time last year, you see we were in high levels of influenza activity with those dark blue bars. So I think those mitigation measures about wearing a mask, washing your hands, keep the distance, is also helping to keep us safe from influenza. But I still want to put in a plug for flu vaccine. I've gotten my flu vaccine. My husband's gotten his flu vaccine. This may be the most important flu vaccine in your life, not just protecting you, but also protecting vulnerable members of your community. And there are a bunch of different flu vaccines now. It's not just the old flu vaccine that was grown on eggs and you couldn't get it if you were egg allergic. There are different vaccines. There's something for everyone age 6 months and older. There's including a vaccine that's safe for pregnant women, including a vaccine that is a nasal spray. So if you don't want needles, you're afraid of needles, you can get it as the nasal spray. And there's a special higher dose influenza vaccine for people age 65 and over. That's all I'm going to say about influenza, just encouraging people to get their flu shot. It is not too late. We're early in the flu season. The rest of this time, I want to focus on the Pfizer and Moderna vaccines, the phases of the COVID-19 vaccine allocation. We are right now in that really early stage with limited doses available. There were 3 shipments of vaccine Monday, Tuesday, and Wednesday of this week to hospital facilities here in South Carolina. And so vaccine administration has started. The issue is that in the very beginning, it's going to be very limited. And so we were prioritizing getting that to workers in healthcare settings who are taking care of patients who are acutely ill with COVID-19. To protect not only themselves, but to also protect the system, because we don't want to end up like New York City in the height of their pandemic, where they were overwhelmed and were not able to give good standards of care, medical care. We're still working out a lot of the logistics about how to roll this out and get this to different populations, people who are at increased risk of COVID-19, severe disease and death. And that includes populations that are the communities that you serve. As we get more and more vaccine, we will be making it more and more available. Everyone in South Carolina who wants to get vaccinated will have that opportunity to be vaccinated. It's just that everybody can't go in this first couple of weeks as we have limited vaccine available. I'd like to talk a little bit about the vaccine because I think understanding this vaccine will go a long way towards allaying people's concerns. For example, I'm getting emails that say, I hear this vaccine was made from fetal tissue. I hear this vaccine may cause problems with infertility. It's going to get into your genetic code, get into your DNA. And there's no evidence for any of that. So I think it helps to understand a little bit about the biology of this. So that circle, that picture, little schematic cartoon is supposed to represent the virus, and the squiggly line in the center is the RNA, messenger RNA. That is a genetic code that tells you how to make more virus. That's how the virus reproduces itself. SARS-CoV-2 is the name of the virus. COVID-19 is the name of the disease it causes. And the spike protein is the key to opening up the lock to get into a cell to cause infection. And that's the target for the vaccine. So how do vaccines work in general? Well, it's as though vaccines provide a sneak preview to your immune system. In this little cartoon, there's a help wanted poster of the virus. And there's some worried looking green coronaviruses there saying, uh-oh, these white blood cells are looking at us. They recognize us. We can't sneak in here. That's how vaccines work, by giving your body a sneak preview so you can start making not only antibodies, but also special immune memory cells to fight off the virus if virus is transmitted to you. This is a new technology. So just to walk you through this a little bit. Remember I said the genetic code is that squiggly line in the middle of the virus. What these vaccines do is they take just one snippet, one small piece of the RNA instructions to make just a virus protein. You cannot get COVID-19 from this vaccine. This is not like polio or the other live viruses vaccines. You cannot get COVID-19. It doesn't, from this virus, it doesn't have the instructions for making the whole virus. It only has instructions for making that one protein. It's wrapped up in a sort of a lipid, an oily coating to protect the messenger RNA and help it get into the cell. And once it's in the cell, once you get the vaccine and it's in your cells will start to make that that spike protein and release it, and then your body gets an immune response. So you get that sneak preview. What can I say about safety, dosing, and will it work in real life? These are the phase 1, 2, and 3 human studies. This is true for all vaccines. And this is how they did it in the Pfizer and Moderna vaccines, which are very similar to each other. In the very beginning, you recruit about 50 to 100 people who are young, healthy, no medical problems, and you're just looking for safety. And this is, of course, after it's been tested in animals, in rodents, and in monkeys. If there's no problems in the animals, they go to those first human volunteers, just looking for, is there a weird adverse reaction, and does it stimulate an immune response? Do you make antibody to it? And then once they've established that, then they give it to a larger number of people, like 500 people. Again, they're looking for safety and immune response, but they're also trying to pick out what's the best dose. Can we do this as a one-time vaccine, or do we need a booster? And then they go to phase 3 studies. Now, one of the things that vaccine manufacturers are doing, because there's such urgency about getting vaccine for COVID-19, is that they've gone to that phase 3 large numbers very quickly. Usually, vaccine producers take literally years to do that phase 3 study because it's expensive to do a study like this. So they do it in little pieces. You recruit 100 people here, and if it looks okay, then you recruit 200 over here. Instead, what they did is they immediately started recruiting tens of thousands of people for these phase 3 studies. So it was not rushed in the sense of, oh, they didn't study in as many people as they were supposed to. Oh, yes, they did. Both Pfizer and Moderna have studied this now in more than 40,000 people. It's just what was different is they recruited them in a matter of months instead of years. All right, let's talk a little bit more about the Pfizer vaccine, the one that is rolled out now. I want you to know that it has been tested. I want you to feel assured that it has been tested widely. It's been tested in 6 countries around the world, and including 39 US states. And that phase 2 and 3 clinical trials, if you combine them, it's enrolled more than 40,000 participants. And more than 40,000, in fact, have had their second vaccination. So we do have a lot of information. And in terms of participant diversity, like who was in these studies, let me blow that up for you a little bit. Worldwide, 42% of people who were in the study were people of color. In the United States, 30% of US participants. They really pushed hard to make sure that we study this in a wide variety of people. 10% of the Pfizer vaccine studies were among African-American volunteers, 13% Hispanic Latino volunteers, American Indian Alaska Native, 1% of volunteers. And they studied it in people up to age as low as age 16 and as high as age 85. I don't know if this is pertinent, but I want to put it out there, and I'd like to know your feedback on this. I saw this quote and thought it was very interesting. So Dr. Anthony Fauci, he's leading the branch of the NIH that develops vaccine. And Dr. Kizzmekia Corbett works for him. And he put her in charge of the scientific lead for vaccine development with Pfizer. And this was his statement. And I don't know whether this resonates with people or is counterproductive, that he said, quote, "To my African-American brothers and sisters, this vaccine that you're going to be taking was developed by an African-American woman. And that is just a fact." So I looked her up because I didn't really know anything about her. And indeed, she just seems like an extraordinary scientist. But I put up this slide to make another point to you. See those yellow highlights? Those are the dates of some of the papers she's published. She was studying human coronavirus spike protein back in 2016 and has put out, I only chose 5 papers here, multiple papers over many years studying the spike protein. So again, just want to emphasize that when it feels like all of this has been developed and so quickly, how is this possible? Remember, the basic science is the longest step of vaccine development, and basic science has been going on for years. To say a little bit about the Moderna vaccine, it's very closely related. It's an M messenger RNA vaccine. They've got a little different proprietary ingredients so that they don't have to keep it in that super cold freezer. It can go in a regular normal freezer temperature. But in terms of where was it studied? Yes, it was studied in South Carolina. Here is the geographic distribution of the states where the vaccine trials were occurring. And in terms of who was enrolled in those studies, 20% of people in the United States in the Moderna vaccine were Hispanic Latino. 10% were Black or African American in the Moderna vaccine trials. And in terms of diversity, in terms of chronic medical conditions, I've mentioned age, that the Moderna vaccine has been studied in people older than 65 years. And I think they were also up to 85 years of age. But I'd also like to point out, they also included people who had lots of chronic medical conditions. Because I'm getting questions about, well, gee, I have diabetes. Is it safe for me to take this vaccine? Or I've got heart disease. Is it safe for me to take this vaccine? This was studied among people with diabetes, severe obesity, heart disease, lung disease, liver disease, including hepatitis B and hepatitis C carriers, and HIV/AIDS patients. And it has been shown to be safe in all of those and effective in all of those in those phase 3 trials. Here's just sort of a summary slide. Oh, and I'm sorry, I need to update that where it says Pfizer limited availability. No, it is approved and it is out there. We are rolling out the Pfizer mRNA vaccine. The Moderna vaccine, that's the one that is up for FDA review this week. We anticipate that it will be approved. And if it is given that emergency use authorization, it would start to become available around Christmas or before the end of the year. And what we're planning to do initially is to use that Moderna vaccine to vaccinate people in long-term care facilities, residents and staff working in skilled nursing home and other long-term care facilities. I do want to talk a little bit about side effects, the possibility of local and systemic, meaning total body symptoms for you, and so that you're aware and so you can warn people, because I think the worst thing that could happen is for somebody to get a single dose of vaccine and then say, ooh, next day my arm hurt and I was really tired. I don't think I'm going to get that second shot. That would be bad because, number one, they're not adequately immunized. They're not protected. And number two, what a waste. That would be a waste of vaccine. So I think understanding that these symptoms are temporary, they last a day or two, not a week or two, they're temporary. And we can anticipate them. We can talk about them. It's a sign that your immune system is responding. It's a sign that your vaccine is working. Now, what about long-term or rare side effects? The vaccines were approved after studying them for 2 months to look for side effects, for adverse reactions. For most vaccines, most adverse reactions or side effects or temporary symptoms will occur in the first 6 weeks. So studying something for 2 months is pretty reasonable. I mean, if we waited a longer period of time, think of how many people might die in that interval while we're waiting. So we feel pretty comfortable that these vaccines are safe, that they've been tested in more than 42,000 people without any scary adverse effects. However, we might not know about rare or long-term side effects until millions of people are vaccinated. I want you to know that right now we are vaccinating workers in healthcare settings, residents and staff in long-term care facilities, and the vaccine has been approved in other countries, for example, in England. So in the next couple of months, we will have a lot more safety data. We'll have information from those who are being vaccinated now. We'll have longer duration information from those who were in the phase 3 trials that started back in June. And we'll have the data from other countries as well. Each of us must weigh our own risk-benefit ratio. The benefit of the vaccine is it's got 95% efficacy. It's 95% effective. That's as good as it gets. Nothing in life is 100%. That's really an extraordinary amount of efficacy in a vaccine. You have to weigh what's your risk of if you get COVID-19, how seriously ill might you become, and to understand that there are still some unknowns, and only time will tell with some of them. But we think those unknowns are going to be 1 in a million events. To put it in perspective, this week and last week, COVID-19 was the #1 cause of death in South Carolina and the #1 cause of death in the United States. That's outstripping heart disease, stroke, and cancer as the number of people who died this week in South Carolina. All right, what about contraindications to COVID-19? Well, we know, but from the phase studies, it appears to be safe and effective in people living with HIV/AIDS. What about allergic reactions? You may have heard about there were 2 severe allergic reactions to the Pfizer vaccine in the United Kingdom. Well, again, to put things in perspective, in the United States, every year, there is a severe reaction in approximately 1 out of every 1.4 million doses of other vaccines. You know, anybody could have an allergic reaction to a vaccine. It's still pretty rare to have a severe allergic reaction. The recommendations, though, and I know this slide says awaiting. Now, I didn't update my slides since December 11th. This just shows you how fast everything is changing. The update now is that there is a recommendation from CDC and the FDA that if you have had a significant allergic reaction to a vaccine, and by that I mean like anaphylaxis, like you needed an epinephrine pen shot, you needed an epinephrine shot. If you've had that kind of reaction to a vaccine, don't get the Pfizer vaccine. Wait for more information. There are other vaccines coming. We will have more safety information on the Pfizer and Moderna vaccines, and some of the other vaccines that are coming have a different platform. You know, they're made in a different way. So right now, serious reaction to a vaccine, shouldn't get the Pfizer one. What about people with autoimmune disease? Like type 1 diabetes, it appears to be safe in autoimmune disease persons. They were in the phase 3 studies as well. What about people who've had an organ transplant or seriously immunocompromised? Nobody really knows yet. That information we're waiting to see as vaccine is rolled out. So it's a kind of a risk versus benefit ratio where everybody's got to make their individual judgment call. How much can I protect myself versus what is the benefit for the vaccine? For pregnant women, of course, are excluded from vaccine trials. It's not tested among women with pregnancy. But there's no theoretical risk for this vaccine causing problems in pregnancy. It doesn't, this vaccine does not include a live virus. It just includes that spike protein. So that theoretically, there's no risk to fetal harm from this vaccine. As data emerge, we'll get more information. Maybe some of the other vaccines might be more suitable, but I do know that there is a Society for Fetal and Maternal Medicine recommends that for women who are pregnant, but who are also healthcare workers, who are at high risk of being exposed to the disease, they recommend that the vaccine be offered to them because they think the benefit is so higher than the risk. I'm going to finish just with my email, so if questions come up, and I can also send this slideshow to you all so that you have access to the information for it. But at this time, I'll go ahead and stop sharing and open the floor for questions. And it looks like we've got a number of questions in the chat box, so maybe I can quickly go through them. It looks like mostly they're saying hello, or can I get those slides? Yes, so we will provide a link to those slides. Yay for the person who got their flu vaccine in August, that's good. What other questions might I answer?
Ms. Terry Giles was the person, she's one of our board members that has already had her flu shot. She doesn't miss her flu shot every year. She gets her shot. So any questions?
Hello? Hello? Can you hear me?
Yes, we can.
Hi, good morning, everyone. I do have a question, Miss Jane, but it is a little bit, it is a question related to how essential the promotores are to get this vaccine. Do you have this information for us?
I do, but it's complicated, uh, and I think that you are very much a high priority. You guys are in the community. You are dealing with people who are at high risk. So it's the same idea of protecting healthcare workers so that they can serve the people most in need. So you're certainly a high priority. You're not in phase 1A because we're imagining that you are not taking care of people who are acutely ill in the hospital with COVID-19. But as we talk about these different phases, we have recommendations, kind of draft recommendations that were formulated by our Vaccine Advisory Committee. And the topic of community health workers and promotores came up specifically. And they are in a high priority category. How are we going to roll that out, or how exactly, can I give you some dates, like when you would receive vaccine? That's where it gets complicated, because it depends upon supply and demand. For example, a hospital might receive 1,000 doses of vaccine for their hospital workers, but maybe only 500 people are willing to take it right now. Maybe some people, they're hesitant, they want to wait. But we're not going to let that hospital just sit on that 500 doses of vaccine. It needs to go, okay, hospital, that's all you're going to use right now. Let's take those 500 and get it out to somebody else. As soon as we finish vaccinating the workers in these high-risk healthcare settings, as well as the long-term care facility residents and staff, that's when we can begin transitioning to our next phase. And that's where promotores and community health workers would belong. What is that date? I don't know, because it depends upon our weekly allocations, how much vaccine is sent to us every week. And it depends upon how quickly people are using it. If phase 1A people are hesitant, well, then we'll start rolling into the next phase.
Thank you so much.
Thank you for what you do.
Jane, there's a question in the chat. Can you give an estimate of how many people and percentages need to be fully immunized in order for the community spread to slow and then stop?
Yeah, that's an excellent question. And part of it depends upon whether virus is, how fast community transmission is going on. Sorry to have stumbled there. So if we could put a cap on this, if we were like we were in August, where the number of cases were continuing to go down, then we would not have to vaccinate as many people. You could have community immunity achievable with 75% of people vaccinated. But right now, it's like the country is on fire. Numbers of cases is going up everywhere, including everywhere in South Carolina. Now, we're not as bad as North Dakota, South Dakota in terms of the number of cases, but with the number of cases continuing to climb, it means that we've got to get even more people, maybe as many as 80 to 90% of people fully vaccinated before things can go back to normal. So sorry to not be able to give exact numbers. It is harder to stop an epidemic when it is increasing. It's easier to stop an epidemic if it's like a flat curve or decreasing.
Okay.
Do I know if doctors' offices are going to give the vaccine to patients? Yes, not all of them. What we've asked is for anyone who normally is able to administer vaccines, so pharmacies, Walmart, doctor's offices, any place that normally is licensed to administer vaccine can apply to become a Pfizer or Moderna vaccine provider to administer vaccine. And we've got more than 800 locations around the state that have already signed up for that program. So including CVS, Walgreens, and other chain store pharmacies. So it may be as easy as getting a flu shot that you'll have to, that you sign up ahead of time, but that you could go to your neighborhood pharmacy. We also know that there are transportation issues for many people, and we are planning to have mobile clinics that can go to different communities to help, just as we've had some mobile testing units, using kind of that same mechanism to bring it to people, bring it to communities.
Okay, Jane, we can take one more question. And then we're gonna need to move to the next thing.
So I hear, I'm a cancer patient. I see a primary care provider from Prisma Health. Prisma Health is one of the providers that has signed up for vaccine. So that's a good example. You may be able to get it at your primary care or even at your specialty care provider, because we've got some other doctors, oncologists, cancer doctors, other offices that have signed up for administering the vaccine as well.
Okay. Thank you so much.
Thank you. And
Yeah.
I wish I could stay on with you, but I have another call coming up, but I really appreciate this opportunity to speak with you all.
Okay, everybody ready? So next on our agenda is the phenomenal, amazing, dynamic trailblazer from Orangeburg, South Carolina, Miss Virginia Berry White. Let's please give her a virtual round of applause. Woo! Keynote today. I ain't finished this one.
Oh, okay.
Keynote today. She has always valued education. She has served our state for over 20 years as the Director of Family Solutions. She teaches and ministers with authority. She's a wife, a mother, and the best part, a grandmother of 6. Now that I'm in the grandmother club, it's so exciting, right? So thank you for being our keynote today.
Thank you. It is great to be here with all of you. I am a certified community health worker, and I am proud to say it, and I am proud to be among such a great group of people. I want to thank Bonita and her team for having me to spend a few minutes with you to encourage you. Especially as we're moving forward through something that we've never experienced before, pandemic, COVID-19, however you want to call it. And so good morning to all of my community health workers colleagues. I want to just start by saying a couple years ago, about 2.5 years ago, I was speaking to a Bible study group at my church. And one of the things that came to me, that God brought to me, was that word essential. That was 2.5 years ago. And who would have thought that I would still be talking about that even today? And so I want all of us to know that we are essential workers. And when you look up that word essential, it's very simple, but very powerful. It means that we are extremely important and absolutely necessary. And so that's how I want to start this morning, by telling each and every one of us, all of you, that you are extremely important and absolutely necessary during this time and beyond. And so when I thought about what I was going to say to you all on this morning, I reflected back to the years 1970 and 1971. I was then 16 years of age. I was pregnant. I delivered a beautiful baby girl weighing 6 pounds. And I must interject that baby girl now is an adult. She is an educator. She is an English teacher, teaches 9th and 10th grade English. And she also has a beautiful daughter who is 19 years of age right now. And so I am totally blessed. And I also have 2 other children as well. So that may seem like a long time ago, but even in the year of 2020, I'm still witnessing some of the experiences that I went through at that time back in 1970 and 1971. And so we are never far removed from yesteryears in the care that we provide or have provided to our families. And so I reflected because I definitely needed some things back then. And what I've experienced back then is still relatable even today in the year 2020. And to start by saying that I wish back then that I had a community health worker, Back then, I needed a mentor, I needed a peer counselor, I needed a buffer, I needed a community advocate, I needed an educator, a resource advocate, I needed a liaison, I needed a patient advocate, I needed all of what you are today, all of you. And although I had strong, loving adults around me, I was afraid, I was lonely, I was confused. I did not feel good about myself. I had no direction of how to deal with my pregnancy. And back then you were ridiculed because you were pregnant at an early age, and you were treated differently back then than the other young people. And so I became a part of a system. And I even think today, as I've done work for so many years and working with, continuing to work with young people, I knew that I had a file number back there. I knew I had a chart number back there. And people many times relate to you and help you by your number. And so I wanted all as community health workers to understand that there are human beings and there are individuals behind a number that you pull off of a chart or you get out of a computer. So I struggled particularly where to go for services and who I could trust to have my best interests at heart back then. I had one of the great things that I have, and I want all community health workers to understand this, that every individual comes with one. You might need help in pulling it out, but I had that inherent strength. Because I was raised by strong Black women, and those Black women did not allow you to give up. They didn't allow you to throw in a towel. They wanted you to keep going. They wanted you to press your way. And so I hope you all are getting everything that I'm saying to you this morning and to us this morning, because I want you to know as community health workers that you are built for every situation that presents itself to you. You have a community. Understand that you have a community. You have a village surrounding you. You have the association. You have the leaders. You have those who've gone before you. So do not take your profession for granted and never think that there is not help out here for you to do the work that you have been assigned to do, because you are essential. You are extremely important and you are absolutely necessary. And so we're in the midst of a pandemic, and right now we do see our way out somewhat because we do have a vaccine that's coming out. But many families are going to be left experiencing different kinds of issues and problems and challenges. Just because there is a vaccine now doesn't mean that families will not experience some things as we continue to go on in this part of the lives of those who are getting vaccines or not getting vaccinated. There are struggles still that remain. There are families that still need our assistance as community health workers. And so I want to stop for a few minutes to give you some quotes. I like to give quotes along the way as I'm speaking. And one of the quotes comes from Theodore Roosevelt. And this is what he says that I want to share with you, community health workers. He says, "Nobody cares how much you know until they know how much you care." That's something that I want all of us to remember. Maya Angelou, a powerful woman, says, "I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel." All of us in our human being state wants to have a sense of belonging. We want to be loved. We want to be a part of somebody, some people, situation. So let's remember that. And then our favorite Martin Luther King says, "Life's most persistent and urgent question is, what are you doing for others?" That's what we have to always keep in our mind when people are coming to us for help. What are we doing? They're coming because they have a need, but what are we doing to help address the need that they have? And I wanted to give that to you today because we need each other. We as community health workers need each other. We are building positive, healthy relationships among ourselves. And that's important. That's important for us to come together as a state of community health workers, as a body of community health workers, like we are doing now for this final meeting of the year. So we can't stop doing it. We've got to show up for all of our meetings when they are held. We have to show up when the association reaches out to us. We've got to represent in specific conversations and situations when we're asked. We've got to share as much as possible. Ruth Bader Ginsburg, the late Ruth Bader Ginsburg, says it like this: to make life a little better for people less fortunate than you, that's what I think a meaningful life is. Our lives, not just for ourselves, but it's for our community. And I always like to say, what we make happen for somebody else, God will make happen for us. I can't stop without giving some praise to God. That's just who I am. And so remember, community health workers, there's another Virginia out there somewhere. There's another male or female out there. There's another family out there that's scared, that's helpless, that they need a helping hand. But also remember that they have their own voice as well. So we've got to remember to practice culture of humility. We got to also remember to provide strength-based intervention. We've got to get to know the culture that we're serving. We've got to listen to what they say that they need, how we can be of assistance to them. In other words, families can take the lead to tell us what their needs are, and we can work to address what they say. They know everything about themselves. They only want you to have their best interests at heart. The good news for South Carolina and surrounding areas is that we have community health workers who stand ready to help, ready to listen, ready to serve. We have community health workers with a knowledge base of understanding relationships and systems. That's so important. Community health workers that know how to link families to resources. That's vital. Community health workers who are also advocates on so many levels. That's extremely important and absolutely necessary. Can I tell you that the workforce is waiting for you? The workforce needs you. The workforce now is redefining itself, and you are in the midst of it. And you can guide them along the way because you know now more than ever. When I think about the principles and qualities and characteristics of community health workers, I think about compassion. I think about genuineness. I think about trustworthy. I think about kindness. I think about sincerity. I think about the ability to listen and so many more principles and qualities and characteristics that we bring to the table. Always strive to be seated at the table and be acknowledged at the table where you are. That's important. It's absolutely necessary to identify your roles in your particular agency, and you need to own it. You need to own wherever you are working and what table you are around and whatever service you're doing. You need to own who you are, own what you do, own what you provide. I look at it like a movie, and I'm almost finished. I look at it like a movie when somebody writes a script and there is a leading actor and there is a supporting cast, and all of us at some time or another we're in a movie, believe it or not, and there are leading actors, right? Actors and actresses, and also their supporting cast. Whatever you fit in, community health workers, you are important. You have the voice. You know what's needed. So before you go into a meeting to talk about your clients, to talk about your patients, remember that you're taking them with you in there. You're taking their voice in there with you. You're taking their situation in there with you. And most importantly, you're taking them as a human being in that room with you. They are not just a number. They are not a number. They are somebody, and you would want the same thing done to you. And so as I think about moving forward, and I'm in my closing, let's remember to practice also good self-care. And when I think about self-care, I know you're going to tell me and you understand the different things that you've had the training on in these past weeks since the pandemic. But one of the things that I want to leave with you in practicing self-care, good self-care, is get rid of the clutter. Get rid of the clutter. Get rid of all the papers on your desk before you leave for the holidays. Clean your desk off in your cars. Organize that paper in your car. Get all of that paper out of your car, in your homes where your office is or your table or wherever you're working. Clean out that stuff. Clutter. Clutter impacts the mind. And when we are getting ready to work with our clients and patients, sometimes that clutter impedes us from providing the adequate work that we need to do for our clients. And it doesn't help us as well. It doesn't give us that good health that we need to do. We can't operate. Our minds can't operate in clutter. So we need to get rid of all of that before we go into the new year. And then I want to also, when we say I'm practicing self-care, get off of Facebook for a little while. Take a breather from Facebook for a minute. You can do it for a week. Come on, I'm just challenging you to do it for a week. Get off of Facebook for a week where so much stuff is going on. And I want you to promise me that if you have an opportunity over the holidays that you will look at the movie, The Social Dilemma. I want you to look at that. Promise me that you will look at that. Coming back into the new year, practice positive talking and really roll our sleeves up when we get back for 2021. Can you imagine we're going to be in 2021? Get ready to roll your sleeves up. Let's get ready to help. And remember, stay the course. Stand ready to defend your profession. And as I said in another meeting with some of you all, always show up. It's important for community health workers to always show up. Thank you so much, guys. I enjoyed today, every part of the day from the beginning to the end. And I look forward to seeing most of you in the coming year. Thank you, Bonita, once again.
Woo! Standing ovation. Thank you so much. Oh my goodness. I know you all saw me taking notes, right? I was taking notes. But one thing I'm gonna say, she said we need each other. And we do. That's all I'm gonna say with that, because I took a lot of notes. We're gonna keep it moving, but thank you so much. We appreciate you. We love you. I know you said that you're retiring, but you're probably getting ready to reinvent yourself and do another.
Yes, I am.
More work. See,
Yes,
I knew it. Once a CHW, always a CHW. Congratulations, and we wish you the best on everything that you're doing. And we want you to know that we love you, and you are our mentor. You have had an impact on everybody's life that you touched, and we appreciate it.
Thank you, dear. Love you.
Okay, love you too. Love you too.
Sis.
Take care. Thank you.
Thank you.
Bye.
Bye.
Everyone.
Camera on it. I enjoy that meeting.